Got a little something that I'd like to share with you, yeah. It's a little bit dark, a little bit cold, and it's hard to bear.
Thank you so much, and hope you guys are having a good time in a happy new year and being a happy new you. Welcome to One on One with Aimon, your online educative show, which comes your way once in a week, and we are delighted for your subscription. We are delighted for your watching these videos. We are delighted for your liking the videos. We are delighted for your learning, relearning, and keeping it right here. Please remember, tell a friend to come and subscribe. Today we'll be talking prevention of mother to child transmission. It is something these days countries call it elimination of mother to child transmission. It was formerly PMTCT, now people call it EMTCT, but our focus will be on this PMTCT right in the next few minutes. So we're saying that by the end of this interaction, participants will be in position to articulate basic facts about HIV, such as what prevention of mother to child transmission of HIV PMTCT is, and what procedures should the health workers follow to prevent transmission in a healthcare setting. Our first question is, what is PMTCT? What is prevention of mother to child transmission of HIV? And we're saying that this is the prevention of transmission of HIV from a mother living with HIV to her baby. A mother can transmit HIV to her unborn baby, either before birth or during birth. That is something that has been proven scientifically. And of course, the other science is that actually a mother can give birth to a child who is HIV negative, even if the mother was HIV positive. That is a discussion for another time. You'll be asking me, how does it happen? It is science. And one of the parts of science we're talking about is this, what we are calling prevention of mother to child transmission of HIV. So we're saying that this can occur during pregnancy, as I have rightly said. It can occur during labor or after delivery through breastfeeding. Great progress has however been made in reducing the number of children born with HIV, and the risk of a woman living with HIV passing the virus on to her unborn child can be reduced to a minimal or a measly 5% or less with effective antiretroviral therapy during pregnancy, delivery, and breastfeeding. So saying that PMTCT services should be offered before conception and throughout pregnancy, labor, and breastfeeding, you see? And this should include early infant diagnosis at 4 to 6 weeks after birth, testing for HIV at 18 months, and when breastfeeding ends, and antiretroviral therapy initiation as soon as possible for HIV-exposed infants to prevent HIV acquisition. We're also emphasizing that keeping women and infants in PMTCT programs after delivery is challenging though, and in some countries more infant infections are now occurring during the postnatal period due to breastfeeding rather than pregnancy or labor due to the high rates of women who leave care. So before conception, the mother comes, they are in care during pregnancy, after birth they attend care briefly, but then thereafter the mothers go. What risk are you putting your child at? A high risk, because you need to be in care. We have said that actually HIV can be passed on when the child is when you still have the child. It can be HIV can be passed on at birth, and it can be passed on to the child during breastfeeding. So you need to stay in care. So saying that around 1.4 million, 1,400,000 HIV infections among children were prevented between 2010 and 2018 due to PMTCT programs. We have examples in Uganda where facilities actually recorded zero transmissions of HIV from their mothers to them, because the mothers have been in care, and they have been so faithful to whatever the doctors had told them, and as a result no transmission was registered from the mother to the children. You're still watching One on One with Aimon, your online educative show. We're talking about HIV, and today prevention of mother to child transmission of HIV. So we're saying that without treatment, however, if a pregnant woman is living with HIV, the likelihood of the virus passing from the mother to the child is between 15 to 45%. This is very bad. So, what is the message I'm giving to my sisters, my mothers, my people, my daughters? The issue is that before conception, of course you've taken an HIV test. Before conception, get enrolled onto the program. During conception, stick onto the medical's orders and advice. During labor, give birth in a facility where they can handle your situation. After birth, stick to what the doctors have told you. 15 to 45% is big. We're saying that of every 10 people, if a woman is not on PMTCT and they're living with HIV and they're pregnant, 4.5 or 5 of them are more likely to transfer the virus to their unborn babies. We all need these babies. We all need our children, because in Africa, the tradition I come from, they take over from us. Let's do whatever we can do to make sure that they are alive. However, antiretroviral therapy treatment or antiretroviral treatment, ART, and other interventions can reduce the risk, as we said, to below 5%. Now, people get worried that, can't I get, because you said this HIV can actually be passed on from the mother during birth. Can't my child get HIV through the medics? We're saying that. Question: what procedures should health workers follow to prevent transmission in healthcare setting? And we're saying that healthcare workers should follow what we call universal precautions. What are universal precautions? These are infection control guidelines developed to protect health workers and their patients from exposure to diseases spread by blood and certain fluids. What do these ones include? Careful handling and disposal of sharps, items that could cause cuts or puncture wounds, including needles, hypodermic needles, scalpels for vasectomy, like the one is used for vasectomy. I just love my shirt, happy vasectomy, okay? And other blades, knives, infusion sets, saws, broken glass, and nails. These ones should be carefully handled and disposed of. What other universal precaution are people taking to make sure that your child is safe? Hand washing with soap and water before and after all procedures. Use of protective barriers such as gloves, gowns, aprons, masks, and goggles when in different contact with blood and other bloody fluids. Safe disposal of waste contaminated with blood or any other body fluids. Proper disinfection of instruments and other contaminated equipment, and proper handling of soiled linen. In addition, it is recommended that all healthcare workers take precautions to prevent injuries caused by needles, scalpels, and other sharp instruments or devices. And in accordance with the universal precautions, blood and other body fluids from all people are considered as infected with HIV and other possible viruses, regardless of the known or supposed status of the person. Ladies and gentlemen, we are saying thank you so much for watching One-on-One with Damon, your online educative show. And for more information on PMTCT in Uganda, you can access this from the new national guidelines 2020 for PMTCT and infant feeding in the context of HIV. Thank you so much. We'll see you next time.